be talking about allergy diagnostic testing. Basically, there are two types of allergy diagnostic testing. One is done through blood tests, and the other is done through allergy skin testing. For the most part, allergy skin testing is done in an office of a trained allergist, whereas allergy blood tests can be ordered by essentially any healthcare professional. The important thing with allergy laboratory testing is the person ordering the laboratory test understands how to interpret the results and orders the appropriate test. Random food panel tests sometimes can result in false positive skin reactions, and this could be difficult to interpret and may lead to inappropriate elimination diets. So it's important when allergy blood tests are being ordered that the ordering healthcare professional understands why they're ordering it, and they order it in the context of the person's presenting history. Now, once you get to the allergist's office, most of us, and I'm an allergist, perform allergy skin testing as a primary tool to try to find out what the person is allergic to. And allergy skin testing actually goes back 150 some years with the work of Mr. Blakely, who was doing some experiment with pollen. And he noted that when the pollen grains were scratched onto his skin, he developed a large area of redness and swelling at the site where the pollen was scratched onto his skin. And over the years there have been modifications, and now the devices we use have very, very tiny small tips at the end that are dipped into a well. I'm going to show you by placing a positive control histamine on my skin, and if you watch carefully, you're going to see all I do is press down, and all you can see is a little indentation. There's no blood, but that is sufficient to introduce the substance into the superficial part of my skin, and shortly you're going to start to see some swelling and redness, and it's going to look like a mosquito bite. It's going to be itchy, but it's not painful, and it's going to go away probably as quickly as it comes. Now, if this were an allergy test, what I would be doing at 15 minutes would be measuring the size of the redness and the swelling, and that would be how I would report the allergy test results. When you're doing a test, you should also have a negative control. So this is saline or salt water, and it's what they use to dilute the extract. So when you prick someone's skin, they shouldn't just welt up because you pricked it, so that's why we do a negative control. And then I'm going to put one of the dust mites right here, and I'm going to put another dust mite right here. And I can already start to feel the itchiness where I pricked the histamine. And that's allergy testing, and we can actually do quite a panel of allergens that includes molds and grasses and trees in a relatively short period of time. So when you come to the allergist for your initial consultation, it's possible on that visit that you will get very specific information about what you are and are not allergic to, and this will be useful information that you can take home. And I'll give you some examples of why it might be important to know this. I've had patients over years that have come to me who their primary physician suggested, because they had allergy symptoms, that they got rid of the cat or invested a fair amount of time and some money in doing dust mite environmental controls, elaborate filtration systems. And when I go to evaluate them, it may turn out that they're not allergic to the cat or they're not allergic to dust mite, and these interventions might have been for naught. So it is important to know what you are and are not allergic to before you start making significant changes and interventions that may or may not be helpful. You can see it's only been about 10 minutes, but I already have two nice welts with surrounding redness at the site where I pricked myself with the histamine control, and this is what one would expect. This is also what a response to an allergen would look like as well. So if I was allergic to ragweed and pricked myself, I would have a reaction similar to this. Now, the way we measure the reaction response is we actually measure the size of the welt. So Cherry's going to measure the longest diameter, and then 5 by 5, and that's in millimeters.
40.
And she's now measuring the surrounding redness, or erythema we call it, and that's how it's going to be recorded in the skin test sheet. And that is allergy skin testing. It's simple, it's quick, and it's very informative.